Now, again, good afternoon, everybody. I'm Sonja Kahlmeir. I'm from WHO Regional Office for Europe. I work as a technical officer in the Non-Communicable Disease and Environment Unit. Physically, I'm based in Rome. I'm with the European Centre for Environment and Health because my original field of work is transport and health, but we do a lot of work on physical activity promotion and health. I'm very glad to be here. This is my first time of meeting this group after initial contacts we had with Jorma Savola. And I'm very pleased to be able to be here and to present to you some of the work and the approaches that WHO is doing in this area. I'm afraid I'll have to turn around a little bit from time to time, so you'll have to watch my back. I'm sorry about that. I was invited to speak a little bit about physical activity challenges and strategies to address them. So I'll start with an introduction on why physical activity is important. Of course, many of you will be very familiar with those figures that I'm going to present, so I'll be rather brief. I'll introduce you a little bit to the public health approaches that we at WHO take to promote physical activity, of course always including sport. I'll say something about the role of different sectors, again focusing on the sports sector, and then present to you the WHO policy framework in this field and some recent relevant publications, activities and programs, some of which you've already seen on the little table when you entered the room. Why is physical activity important? You probably know that in Europe, non-communicable diseases are the largest contributors to the burden of ill health. And you can see this illustrated in this graph, and you see here that this orange little figure is of a quite impressive size in Europe also if you compare to other regions of the world. This is the American region, and this is Western Pacific. But also if you compare to other causes like injuries or communicable diseases, this is a very important problem in Europe. Around 1/4 to 1/3, depending on how you measure physical inactivity of the population, does not reach the recommended levels of physical activity to maintain and improve health. The recommendation, as you're well aware, is at least 30 minutes of moderate physical activity on 5 days a week. More is better, of course, but this is the minimum recommendation that everybody should reach. This lack of physical activity leads to 600,000 deaths per year in Europe alone. This is about 5 to 10% of the total number of deaths per year. And over 5 million of disability adjusted life years are lost due to this lack of physical activity. There's an unequal distribution with a higher burden in Central and Eastern Europe as compared to Western Europe. This is not only a health problem, but it is a problem for society at large, for example, having very important economic consequences. I'm not going into the details of the figures, but they'll be printed out for you. It's also interesting to note that, for example, in Switzerland it's been possible to estimate the savings that the current levels of physical activity already bring through saving of health costs, pain and suffering, of quite impressive figures that you can see there. Obesity and overweight is one of the most visible effects of a lack of physical inactivity and unhealthy diets, of course, is also a very important risk factor. Obesity is not just a matter of aesthetics, as you would probably agree from this picture, but it is actually becoming, or some people would argue already is an epidemic. The prevalence in Europe is between 5 to 20% in men and up to 30% in women. This means that about 400 million adults in the region are overweight and 130 million are obese. These are enormous figures. And the trend is worsening, actually. this is not only an adult problem, unfortunately. 1 in 5 children in Europe is overweight, and their number is increasing by about 400,000 children every year. Again, the trend is increasing quite dramatically. However, physical activity is much more than just obesity. As you know, physical activity has a link to many different health outcomes, among which overweight and obesity, but also other very important health outcomes like cardiovascular diseases, but also independence in old age, which is going to become more and more important as societies are aging. Mental health, stress tolerance, different types of cancers, etc. So let's not forget that physical activity goes beyond obesity and overweight. Now I'm going to introduce some public health approaches to physical activity promotion. Let me start by introducing a framework that many of you probably are familiar with, developed originally by Whitehead and Dahlgren, published in Lancet in 1991, which gives a very comprehensive framework of the different determinants that are important for health at large, but also for physical activity. So physical activity is not just an individual responsibility, even though individuals are of course at the heart of this framework, but there is a larger environment around that, obviously, the natural environment, built environment, the economic environment and the communities, values, social roles, etc. So there are a lot of different levels that we can work on. A very frequent approach to physical activity promotion, especially a few decades ago, would probably look like this, as a comic artist in Switzerland has shown, that somebody would go and tell people, do something for your fitness, don't just hang around all day. And then what usually happens is that people try to do a little bit, but it usually doesn't take them very far. Shown in a different way, there are interpersonal factors, as we've seen before in the framework, combining motivation, knowledge, and skills of people. And there's, of course, the societal and physical environment. And we can work with promotion on both levels. So the approach that we just saw would be to push people on the interpersonal level, to motivate them, to increase their skills, and to tell them to do something, while we don't change anything in the social or physical environment. As we've seen before, if you don't change the environment, so if the TV is still there, probably after, or also if the urban environments favor motorized transport and hinder walking and cycling, and these are pictures from Rome, but they could be taken in many other cities in Europe, probably, making walking and cycling virtually impossible, or at least very difficult. People stop after a while, and as one of the effects, get overweight, for example. So the other approach that WHO is very much investing in, and that has a lot to do also with sports for all concepts, of course, is to work on the social and physical environment. So to reduce the slope, to reduce the slope here, and make it easier for people to be physically active. On a population level, this very same approach looks like this. You always have a certain number of people that will move, no matter how hard you make it for them. And probably some of those people are in that room, the Danish colleague who's been walking here, and others. So no matter how difficult it is, some people will always be physically active. However, if we make it easier, if we improve the social and physical environment and make the healthy choice the easy choice, then suddenly a much larger part of the population is likely to become active. What is the role of different sectors in this concept? Of course, me coming from the health sector, and you coming from the sport and some maybe physical education fields, we have a key role to play. We're the key stewards in this area, and we have to take a leading role in fostering this field. But we cannot do it alone, unfortunately. You've seen that the scale of the problem is simply too big. We're speaking about millions and millions of people that we have to get moving across the region. So trying to do this solely working through schools, for example, will simply not solve the problem. So we have to work across sectors, and that's one of the reasons why I'm so happy to be here. Often also environmental approaches, as we've seen also before, are very important, but they're not controlled by the health or sports sector. They're controlled by the transport sector or by environmental sectors. So we need to build new partnerships and work across different sectors. To address this challenge is quite complex. It's very important that the solutions and options we're offering are equitable, because there is inequality in physical inactivity. There are population groups that have higher levels of inactivity, and that are those that have, for example, less money to pay for services or facilities. So we must make sure that the options that we are providing are not increasing this gap, because they're reaching those that are already active. And there are some approaches out there that go in that direction, and that worries me quite a lot, because we're actually making it worse instead of better. Also, while the sports sector is, the sport facilities are a very important part of the solution, we cannot solely depend on those, because we only reach one part of the population, but often not the most sedentary part, which is the part that we want to reach most. And here, for example, walking, cycling, or climbing stairs can be a very good approach, at least to get them a little bit more active and then take it from there. Solutions must be cost effective, of course. They must be easy for people, because we all know that it is hard for people to get started. So it must be enjoyable. This will increase the acceptance of all solutions that we propose. I'm not going to speak about that very much. You're keeping an eye on time, okay. But just to mention that active transport is something that we work quite a lot on in the European Centre for Environment and Health. Just because there are so many opportunities in that field, the travel patterns of Europeans fit the needs perfectly, because so many trips done by car are short trips. They are done in urban environments, and they could actually be easily replaced by walking and cycling, where the opportunity is right to facilitate those choices. We know that one of the most frequent arguments of people why they are not physically active is that they claim they don't have time. These are the same people who probably watch TV 2 to 3 hours a day. Nevertheless, they, in their perception, perceive that they don't have time. And there is no use in telling them, you do have time, just replace the TV watching. This will not work. So we have to be mindful of the restrictions that people perceive in their life. And walking and cycling somewhere where you have to go anyway will make it very easy for them. Instead of maybe having to go somewhere, especially when time available. Again, options need to be equitable and easy, and cycling and walking provides for that, because most people can do it. It doesn't cost a lot of money, and it's enjoyable, given the right environments, of course. What do I see, or WHO see as a possible role of the sports sector in all of this? Of course, the sports sector is very important to support the policy response to address these challenges, and I think very much is already done in this field. The sports sector can be open to connect with related policies rather than trying to stay in their own field, and I've seen a lot of movement, especially in the recent years, from different sectors, including sport, to work more across the sectors and together towards the common goal of increasing physical activity. It can help to disseminate a culture of active leisure beyond elite sports and beyond the classic sport activities, using a broad definition of physical activity rather than a narrow sport definition. It can support provision of healthy environment and healthy choices to ensure access for all, and of course Sports for All is a classic, wonderful example for that. It can engage with local, national and local governments, because many of the solutions have to be provided on the local level where people work and live. So the community level is very important, and it can help to develop and deliver community sport programs as a means also for community-wide mobilization, because of course sport can be very important for social mobilization, reclaiming of spaces, improving public safety, etc. And again, Sports for All is already contributing to that. Now to the last part. WHO's mandate for action goes back about 10 years, so this is a very young field, as you're all aware, of course. The two most important ones I want to point out here are the Global Strategy on Diet, Physical Activity and Health, which was endorsed by the World Health Assembly in 2002. The preparation started in 2002, and then it was adopted and endorsed in 2004. This is now, of course, a very important basis for a lot of the work that we do. WHO developed a number of different policy tools for action to support member states in implementing the global strategy, and you can find them on these websites. One of them, a very nice guideline to increase levels of physical activity, which identified a number of key success factors for physical activity promotion policies, and I guess you'll agree to many of them. We need political commitment, first of all. Without that, nothing will work. Knowing from where you start, so having surveillance data is very important. Working with other stakeholders, integrate into national strategies and policies, but also work at the local level, respect the local reality, also investing into the workforce, so into education of practitioners, etc. And of course monitor and evaluate what you're doing, what works and what doesn't work. In the European region, we've endorsed the Charter on Counteracting Obesity as a part of the implementation of the global strategy. The second action plan for food and nutrition has just been endorsed by the regional committee, and as it was initially discussed with member states whether a separate pillar of that action plan should be on physical activity, but actually it was decided that physical activity was too important to be only a pillar, I'm saying in square brackets, of the action plan on food and nutrition, and that's why a separate document was developed, Steps to Health, a European framework for the promotion of physical activity for health. The Charter, as many of you know, and some of you are probably present, has been adopted at the Ministerial Conference on Counteracting Obesity in November 2006 in Istanbul. It recognizes and underlines the importance of physical activity as a part of the solution next to healthy nutrition. And it promotes physical activity, and again, the ensuring of opportunities within its goals and principles, and member states have committed to that by endorsing the Charter. I'm not going to speak very much about the second action plan, but one of the related areas speaks also about physical activity, so it makes linkage to that topic. And mentions it in different specific actions. An action plan has been developed which aims at both nutrition and physical activity. This document, some of you may know it, you're very welcome to take copies in the back of the room. is a call for action which has been presented at the conference. It calls for awareness and attention to physical activity as a health determinant, but it encourages and inspires national action. It doesn't only call for action, it also gives guidance and presents practical tools for member states who want to do something in this area. So it's meant to serve as a guide for member states in implementing physical activity. It's also available in different languages. As last, few selected activities and products that can be helpful for you to be aware of in this area. We've developed also in the framework of the obesity conference 2 advocacy booklets on physical activity and health, and copies of the more general overarching one, physical activity and health in Europe, evidence for action, can again be found at the back of the room. They're aimed at policymakers. They're advocacy products. The language is very simple. It is not for scientists. It is really for policymakers. And the feedback we've received from member states, including apparently from ministers who've read it, and some of them said that for the first time they understood what physical activity and health meant. So we seem to have achieved what we wanted. And they're also available in a great number of languages. I think we're at 8 languages now, including Slovenian, Danish, Italian, Russian, of course, etc. So please go to our website and download them. Or consider, if they're of interest to your country and not available in the language yet, to translate them, because we very much encourage that and make the templates available. Very briefly, the key messages. We don't need to wait any longer. The evidence is available. We can act. We can start acting. There are still some open research questions that we will certainly invest into. But that's not a reason not to act. Physical activity should be integrated in everyday life. That's the only way that we're going to reach the millions and millions of people that we need to reach. There are experiences available on what works in different sectors, so there are good examples that we can follow. The health system has a key role to foster multi-level coordinated actions in many ways. And also very important, physical activity is an individual responsibility, but it is also a societal responsibility to provide the environments that make it possible to be physically active. And that has been really a paradigm change, I think, in many heads, and a very important step, also reflected in the obesity chart. We have also developed an online inventory of documents on physical activity promotion to make the existing documents and experiences available, because there was an increasing interest in the national activities, but no real overview existed and an easy way to access those experiences. So we've established this inventory, which now includes about 400 documents from health, sport, transport and environmental approaches. So not only health, we're taking a very broad approach here. Including in those 400 are about 50 national policy documents from 23 countries, and we're continuously including more and more as they become available, as an example for others to follow. These will be printed out so you can go to the website yourself. Another area that we're doing quite a lot of work in is to develop guidance and tools for economic valuation, because money is a language that politicians understand very easily. And if you can present what it costs or what you can gain, then people will listen to you. It is also a tool that other sectors, like the transport sector, use as a standard tool. So it will help us to speak their language if we develop similar tools for them to use. So we've started with support from Austria mainly, but also Sweden and other countries, to develop guidance and a very practical assessment tool to assess the cost benefits from health effects from cycling and walking. The tool currently is on cycling, and the only 2 figures, you can't see because it's too small here, that people have to to put into this model, which is based on an Excel spreadsheet, is the number of trips that are either monitored on a particular road, in a city, on a country, or projected to be the result of a certain intervention, and the average length of those trips. And then the rest is calculated automatically by this tool, which is based on best available evidence, and we've had the pleasure of working with about 25 experts from different fields in different regions of the world, and received quite good feedback on that. So if that's something of interest, to speak with your policymaker because you think they should invest in cycling and walking, and this might be something that you can use. And if you apply it, please let us know and send us the result of your application, because we want to make the case studies and examples available. And if you have any feedback, we are very open and interested to have it. You can download it on our website. We're currently starting the development of a similar tool for walking and hope to have it available maybe in a year from now. We're still waiting for the donor to make the final commitment. Another program, which of course many of you probably are already aware of, the Healthy Cities and Urban Governments program, launched 20 years ago actually. They have their anniversary this year. It's now including about 80 cities in 28 countries, altogether 1,200 cities and towns across the world. Its main aim is to involve local governments into health development in a very comprehensive way, including health considerations into economic regeneration and urban development and planning. And in the 2003 to 8 phase of the program, healthy urban planning and physical activity and active living are actually one of the core themes, and we're working on different projects in this area of physical activity on the local level. Another relevant activity that I wanted to bring to your attention is HEPA Europe, the European Network for Health Enhancing Physical Activity. And if I may add to what Jakob Kornbeck has said before, actually our Finnish colleagues have developed the HEPA concept, not WHO Europe. And I've just said to Jorma before that without the Finnish, who are really the fathers of this concept, HEPA Europe wouldn't exist probably today. And we're very glad to have very active involvement of our Finnish colleagues in this. It brings together different institutions and organizations from all over Europe. We've currently over 50 confirmed members, and if I count in all the new applications, we have about 80 from about 25 countries across Europe. It's institutional memberships. We have 2 honorary individual members, but all others are institutions, including ministries, academia, NGOs, from across the board. So our current chairman represents the sports sector, we have public health sector, we have environment sector, we have transport sector institutions. It collaborates closely with WHO Europe. As you can see, we've been invited and accepted a facilitating and coordinating role, which is played by me. A key focus is on facilitating these multi-sectoral approaches, as I've mentioned before. It is meant to advocate physical activity and to support the exchange of information, to promote and disseminate innovative HEPA strategies, programs, approaches, and good practice, and to also promote and engage into research. And you have the leaflet here and can find more information, including on applying for membership, if any of you are interested in that. It's all on our website. A few selected activities. HEPA Europe has been instrumental in developing that inventory that I've just presented before. We have another activity was to collect case studies of collaboration between transport and physical activity promotion, which brought together some 50 case studies, practical examples. Also conceptual work is done, for example, developing a methodological framework for physical activity promotion. and I've already mentioned the guidance on economic valuation that we're investing in. There are a number of working groups that work on specific topics. One on physical activity and sport promotion in children and adolescents, which is led by our colleagues in Switzerland, the Federal Office of Sports. There's a working group on national approaches and networks for physical activity promotion, and our colleague Anita here is organizing a workshop on national strategies in the framework of that work group later this year, and the handout is also back there, where we want to exchange experiences on challenges and solutions that occur in implementing those national strategies across Europe. Another work group looks at primary care approaches to physical activity promotion. We have annual meetings, the next one taking place in September 2008, and please mark it in your agenda because the call for abstracts and symposia is still open until 5th of June, so still a few days to go. Please go to the website if you're interested to come and submit abstracts or symposia, and join us in Glasgow. Wolfgang Baumann also invited me to try to think about potential areas for collaboration, and this is a very non-exhaustive first list of potential ideas that I had when I thought about this, and I know that we're going to talk about this more over the next 2 days. Of course, we welcome warmly any support to the WHO advocacy activities that are ongoing, and I see a lot of potential synergies there. We're also interested to collect data and information to make it available, for example, through the inventory. So if you know of documents or activities or data that is collected, then let me know that we include it into the inventory and make it available. Case studies are of utmost importance, especially if they're well evaluated. We have an ongoing collection of making these case studies available and tools to describe them. We could think in various ways of developing and helping an application of WHO tools and guidance, but also work together in the development of guidance as with ESFAM and HEPA Europe currently for these new guidelines for sport for all in sports clubs. So there are many opportunities, I'm sure, in this field. Supporting selected activities and projects with national and local partners. I guess the only limit we have is the sky, certainly not our imagination. So you can find more information here, and I thank you very much for your attention.
A few minutes for some questions to Sonja, if any, please.
In Rome, since the middle of 70s, we have so much campaigns to encourage people to be active, to stimulate people to be active. In the western part of Europe, especially, I'm talking about Germany, Finland, the Scandinavian countries, the Netherlands. Until today, we have tried to make new programs. And the conclusion at this moment is the same situation as we had in the middle of the 70s. And I know the society has changed. But what is really going wrong? Where we have made mistakes?
This is, of course, the question of all questions.
That's why I'm here.
Indeed, no, a very important and good and interesting question. Thanks a lot. I'm by no means able to give a definite answer, but I will share some thoughts I have on that, and of course everybody else can join me in. First of all, maybe I'm not as skeptical as you are. And if you mentioned the Nordic countries, Finland, for example, is a country that has, first of all, data since 1975, I think. And therefore is able to show that actually they're one of the few champions, probably together with Canada and not that many others, where physical activity levels have gone up. And this is the result of a long-term investment, political will, and accordingly the right investments, important investments. So they have not taken this lightly. They have done a lot right, and we have a lot to learn from them. So I think we also have examples of what can work and what is needed. But it is not easy, the task we have at hand. So it's not something that we can achieve in a year or two. So we need a long breath, I think. And we need the help of policymakers and to ensure that the political will is there beyond the next election period. That is certainly facilitated by developing the right policy frameworks to make sure that this goes beyond individuals that can carry this forward. But that something is written, endorsed by governments at best, to ensure that this is a long-term investment and not a one short of program that is abolished after 2 or 4 years. We just have to face the reality that this will take a long-term investment. But we have so much to gain and so much to lose that I don't think it's really a question. You said also the society changed. It did change dramatically since the 70s. And environments have become so much less supportive for physical activity. Unhealthy food is so much more easily available to children, to all of us, actually. So the challenges are becoming bigger, so it's getting harder, unfortunately, not easier for us. What else could I say? I guess that was maybe a few points. I hope anybody join me, please.
Thank you very much. I think we have to hurry a little bit because it's quite late now. So may I ask Bordo to